TB control. So TB infection control in India, this is on a high priority. Okay. Controlling TB comes under high priority to prevent the transmission of TB between patients, and the community, patients and the healthcare workers. Okay. Tuberculosis is one of the number one cause communicable diseases that India as a country faces even today. We still rank high uh, in the number of prevalence of TB cases. Okay, so tuberculosis is caused by Mycobacterium tuberculi. Okay, it's a droplet transmission infection. So from your cough or from your sneezes from an infected patient, it can travel. Okay, to a small distance, not long distance, to a very short distance, and it can affect a susceptible host. Okay, that is how tuberculosis spreads, droplet infection. Okay, so whenever a TB patient is coughing or sneezing, droplets that are infectious is around them within 4 feet. Okay, within 3 to 4 feet. So anyone who comes in this circumference, okay, the circumference of 3 to 4 feet around an infected patient, high chances that the host will also be infected by TB. So TB infection prevention and control, some key strategies given by WHO. Okay, they have WHO has integrated package of TB infection prevention and control. So there are 7 steps in that. So first step is triage of the patient. Triaging the patient means identify which all patients show the signs and symptoms similar to TB. When they come to hospital, when they're standing in a line or a queue, okay, wherever a patient is who is showing the signs and symptoms like coughing, blood, sneezing, okay, they look very thin, very lean, and very thin. Lots of muscle wastage is there. Wasting is there in their body. Okay, they look very weak, feverish, malnourished. Okay, when these signs and symptoms are there, suspect them of having TB and separate them from the other potential patients, visitors. Okay, take them away from public place. That is triaging the people. People who are infected with TB, they all should be kept together, or they should have a separate line, queue, a separate place where they will be assisted healthcare wise. Okay, so that is the first strategy. Triage the patient. Second is respiratory separation. When you are triaging the patient, you are separating them away from the general public. Okay, so that is respiratory separation. You are taking them away from the same air they are sharing with somebody else to breathe. So that is the respiratory separation. Physically removing them away from a public place or a very crowded place. Then prompt initiation of effective TB treatment of people with TB. Okay. Even if you're triaging a patient, does not mean they are actually suffering from TB just by the signs and symptoms. Coughing, sneezing, coughing blood, okay, looking thin and lean, these can be associated with various other diseases as well. Okay, so diagnosis is important. Once you have diagnosed and the diagnosis diagnosis has concluded that the patient has TB, or the sample, what is the TB sample, then immediately you have to start the DOTS therapy, TB treatment therapy. Okay, it goes for up to 6 to 9 months. 6 months is very exclusive, and you have to be very strict with the medication. 4 medications will be given, and then respiratory hygiene will be taught to them, which is very important to prevent the further spread of the disease. Using mask, using a cloth or a tissue or a paper to always cough or sneeze into. Do not cough or sneeze into the atmosphere. Always cough or sneeze into a mask, a piece of cloth, handkerchief. Okay, always cover your mouth and nose while you're coughing or sneezing. You're teaching them these etiquettes, respiratory etiquettes. It can also prevent the spread of infection. Upper room germicidal ultraviolet system. Wherever the TB patients are admitted, or if it's a TB ward, will usually have this filtration system. This installed system, they pass UV light in the entire room, and it's kind of sterilizing the room. It's killing the mycobacterial tuberculosis which is present in the air, common air in the that is present in the TB ward, mostly is affected by Mycobacterium tuberculosis. But when you install this filtration system, this germicidal filter system, it will, by ultraviolet rays, it can uh, kill all the bacterium. Then ventilation system, proper ventilation should be available, and the air ventilation should be in all directions, north to south, south to north, east to west, west to east. Okay, in all four different directions, air movement, air currents should be able to move properly. Okay, if you are setting up a TB ward outside the hospital, making it a half walled wall, keeping a ceiling upstairs to ceiling above to protect the patients, staff, visitors from direct sunlight, storms, okay, outside elements, rain, to give shade. A ceiling should be provided, and the walls on all the four sides should be just half walls, not complete walls up to the ceiling. Can build these kind of structures outside the hospital premises, around in the hospital premises, and you can make a TV board. And then when particulate respirator, N99 mask, N95 mask, N99 mask, they all come under particulate respirator within the framework of respiratory protection program. So in this case as well, hospital will provide N99 and 95 masks to the staffs who are in the hospital, as well as the patients who are in the hospital, to protect the staff and the visitors and patients. To have this respirators in your inventory, don't be out of stock of it. Especially if you're seeing a lot of TB patients on a regular basis. So key elements in TB infection prevention and control: patient safety, human resources and health, and patient-centered care. These are the three main pillars of TB infection control. The patient safety, you have to reduce the hospital or healthcare associated infection, spread of TB, or if anyone is getting TB just because being admitted to the hospital, is also a healthcare associated infection. Okay, and using all the IPC guidelines, infection prevention control guidelines that you will study in the ICM courses. Okay, when you implement all these guidelines, it will contain the TB spread to an extent. Human resources for health, those who are working in TB wards or those who are working in the hospitals. Okay, they should under OSHA, occupational health and safety programs, proper PPE, personal protective equipments. Do not allow pregnant staff to be posted in the TB ward. Do not allow immunocompromised staff to be posted in the TB ward. Okay, these measures a hospital should take. Okay. Then person-centered care. Uh, every patient who is been diagnosed with TB will be having some or the other associated stigma attached to TB. Okay, they will be not invited to a social gathering, or they will not be able to stay along with their family because they are suffering from TB. Okay, so these kind of social stigmas are present, even not just for TB patients, but also for HIV/AIDS patients. Similar stigma you will see in the society. Okay, so you have to address this stigma. healthcare workers' well-being. We should develop a TB infection prevention and control measurement tools that can make patients a challenging life more easier. Okay, so this is the patient-centered care given. So these are the three main elements of TB infection control. There are 10 steps or actions which are mentioned in your textbook. Those who have the textbook, they can mention the page number for the new joinees to understand. So the first step is safety without stigma. Okay, without stigmatizing the patient or being judgmental towards the patient, proper care, healthcare should be given. That is the first step. Okay, address the stigma. Make sure community health educations are given so that you address the stigma. Include patients and community in advocacy campaigns as well. Patients who are suffering from TB and even the community in which TB is very common, rural communities, small towns where TB is still very common. Okay, conduct campaigns there to address the stigma, to make the people aware of the treatments available within what is the time frame within which treatment can be completed. Okay, chance of life, how the length of the life of the patient will be affected. Okay, these things can be taught. Then ensure safe sputum collection. So whenever a case comes to the hospital, and they want to do sputum test, fast bacilli test, sputum test has to be done, and you have to collect the sputum sample of a suspected TB case. You have to ask them to go out in the open area, cough out the sputum into the container, and then bring it back. Don't encourage them to do sputum collection in a closed room. Okay, encourage them to go out in the open, find an open area and do the sputum collection. Promote cough etiquette and cough hygiene. Cough etiquette and cough hygiene. As I mentioned, use if you don't have a piece of cloth on you to sneeze or cough into, use your elbows. Okay, if make sure you are using mask, you are covering your mouth and nose whenever you're talking or when you're coughing or sneezing. Okay, avoid community gatherings as long as the treatment is ongoing. After the treatment is completed, you can start participating in community gatherings. Then triage the TB suspects for fast track separation. Just give me a moment, 1 minute. Sorry for the delay. So triaging the TB suspects for fast track or separation, which means whenever you see a patient who is exhibiting such signs and symptoms very similar to TB, they're standing in a queue or they're standing around in a crowded place in your hospital, immediately separate them from the crowd. Encourage them to do a sputum collection in the open and send the sputum for fast track acid bacilli test, which will give you results within 24 hours. Otherwise, we have another test, that is Mantox test for TB, but you have to wait for 3 days. Okay, Mantox test, it will take 3 days to show you the diagnosis. But when you do the acid fast bacilli test on sputum sample, immediately within 24 hours, the results will be out and immediately you can start the treatment. So triage the patients who you suspect that they are definitely suffering from TB based on the signs and symptoms that you see and based on the history collection that you have done. Ensure rapid diagnosis and training initiation as soon as the diagnosis is out and if it is confirmed that the sample you have is of a TB patient, it's TB positive. Okay, it's mycobacterial tuberculosis positive test. Immediately, you have to initiate the DOTS therapy. Okay, guide them to the nearest DOTS therapy center. The hospital may also have its own center, and pulmonologist will be available to prescribe the medication. Immediately from day one itself, DOTS therapy has to be started. Okay. Improve the room air ventilation whenever if you are admitting the patient in the TB ward or any ward, make sure it's a proper well lit and well ventilated room you are admitting the patients with. Okay. And also if you have to in a rural area or somewhere, if the TB cases are increasing and you have to do a makeshift ward, as I mentioned earlier, half walled all the four direction, half walls you can make, and there should be a ceiling to protect the inhabitants. Okay, and you can keep the patient in such ventilated rooms because from all the four directions air currents should pass. Okay, protect the healthcare workers. Don't allow pregnant staff to be working in the TB ward. Don't allow immunocompromised staff who have recently have undergone a surgery or something, or who are suffering from an infection. Okay, so don't allow these staffs to work in the TB ward. Okay. So, and also those staffs are working already. They should have enough number of masks, gloves, hand hygiene facilities, face shields, goggles. Okay, these things, face shields, at least face shields and masks should be present for all the staff, and gloves should be present for all the staff. Capacity building is the 9th step, which means you are increasing the number of healthcare workers to deal with TB. How? Even though you have a limited staff, you can encourage medical students, nursing students, physiotherapy students to do their contribution towards TB healthcare. Okay, you can ask their participants, you can seek their participation in community health programs, village campaigns. Okay, any campaign work, any NGO work, you can make sure the students who are pursuing their education, they can participate because at the training level itself, they will understand the deal of TB, how to control it. Okay, they themselves, when they are health educated and aware, they can perform better in campaigns, community participation, even in hospitals when they are being trained. Okay, they can do a good job. So that's how you can do a capacity building. Okay. Then finally, monitor infection control practices. All the hospitals will already have infection control practices, but is it effective enough? Whatever practices they are doing, is it effective enough? Is it showing some positive results? Okay, are you able to contain the TB infection um, based on the infection control practices that you already know of? Okay, so you have to monitor the efficacy of these practices. Okay, so these are the 10 essential actions for effective TB infection control. You can read these statements, these paragraphs from the textbook later. So TB infection control program, it comes in 3 layers. The major amount of work and the major capacity of health staff is in the bottom, which are the patient, which are the staff who are directly in contact with the patient. Okay, and they should use respiratory protective equipments. Those who will be contacting, touching the patient, or be caring for the patient. Okay, all the healthcare workers, clinical staffs, non-clinical staffs, okay, who are around the patient, will have to use respiratory protective equipment. At the second stage is environmental control. Okay, at the ward level. Okay, give a proper infrastructure, physical infrastructure for controlling and containing TB spread. Okay, as I mentioned, how the architecture should be, where the sputum collection should be. Okay, how will you triage and separate the patients? That will come under the environmental control. Then first, the administration also has a part, very small part, but a very main part. The administration of any hospital should have measures put in place to protect their staff, protect the community, protect the visitors from TB. Okay, so it all begins from the administrative measures. When they lay down the rules and guidelines, it will be followed by the bottom two, a cadre of organization. So that's about today's session on TB control. If you have any queries,